Hey family, it's Dr. Yola. I'm not here with a COVID-19 update. Well, at least not directly. It's instead an answer to a question that I have gotten asked a lot, especially over the past couple of weeks. And that question is, are you getting the COVID-19 vaccine? And then the follow-up question is usually, well, when? And I always like to let people know it's not a matter of if I get the vaccine, but when I get the vaccine. As a practicing physician over the past almost 20 years, I've never been an early adopter of new medications, of new vaccines, or of new technologies. It's just not what I've done. I've waited, I've watched, I've observed, I've collected data, I've read studies, and then I make my decision, right? But I also acknowledge, especially right now, that I sit in a position of privilege, right? As a physician, I'm sort of on the periphery of the front lines. I see patients, I see pediatric patients, I see patients in terms of weight management, chronic disease management, usually through nutrition. But as a private practice doctor, I get to decide which patients I see, how I see them, and when I see them. And I can make sure that I have all the layers of PPE that I need. Compared to my brothers and sisters who are on the front lines directly, the ICU doctors, the ER doctors, the hospitalists, all of my brothers and sisters who are in direct line of fire every single day. I understand that I sit in a position of privilege to be able to, my risk is less than theirs. And so I want to, one, acknowledge the sacrifice that you guys are making, both in terms of patient care, but also in terms of being on the front lines and receiving the vaccine, because it allows those of us who are sort of converters to be able to watch and wait and see. So I thank you for that, because that's the position in which I sit. And so I wanted to sort of talk with you through how I have made a decision to get the COVID-19 vaccine. And what I do is I usually start with what I know, right? What do I know about COVID-19 so that I can weigh the benefits and risks? What I know about COVID-19 is that for every person who has COVID-19, the original COVID-19, they could infect 2.5 people over a 5-day period of time. And over a 30-day period of time, they could infect over 400. But now we have these variants, these mutations of COVID-19, at least 3, if not more. Which isn't surprising, because the more a virus spreads, the more it replicates, the more it mutates. It's just viral replication 101. It's like when you have an original and you make a copy of a copy of a copy of a copy, after like the 50 millionth copy of the copy, it barely looks like the original. And so the more COVID-19 is spread, the more it will mutate. The more it will mutate, the more diabolical it may become. Right? So much so that now for every person who has COVID-19, they can infect almost 5 people in a 5-day period of time, which instead of over 400 people acquiring COVID-19 over a 30-day period of time, it becomes thousands, right? And the second thing I know about COVID is how it affects the body. It can impact us from the crowns of our heads to the soles of our feet. As my grandmother says, from your rooter to your tutor, right? So neurologically, you can have brain fog, you can have loss of taste and smell, and we're still not clear on when and if it comes back for certain patients. But we can have other more severe issues like weakening of the heart muscles, abnormal heart rhythms, even a heart attack associated with the higher risk of clotting that's associated with COVID. And it isn't just heart attacks, we're also talking strokes and something called COVID toes, where small clots travel all the way down to your toes and block blood flow. We also know that COVID-19 impairs lung function, kidney function, and liver function because of the high levels of inflammation that are triggered. Systemic issues like chronic fatigue, right? And now just recently, we have now observed that type 1 and type 2 diabetes are now associated with COVID-19 infections. Not just the severe cases, where a recent report demonstrated that 14% of individuals with severe COVID-19 were then diagnosed with either type 1 or type 2 diabetes. I'm talking people with mild symptoms also developing type 1 and type 2 diabetes without previous risk factors. And this is happening in the adult population as well as with our children. And speaking of children, we also know that COVID-19, although not as impactful as something like influenza within the pediatric population, is associated with multi-system inflammatory syndrome. And as more people get COVID and more children get COVID, the more we will see children suffering from multi-system inflammatory syndrome, which has been linked to issues of the heart, where multi-system inflammatory syndrome can actually impact the blood flow in the coronary blood vessels that can impair a child's heart health for the rest of their lives. And then what we also know about COVID-19 is that 27 million individuals as of February 3rd have now been infected, and over 460,000 individuals have lost their lives to COVID. So that's where I start with what do we know about the virus itself. And then it's what do we know about the vaccine? What are the components of it? What are the side effects of it? What should we be concerned about? Now, I get it. When you call the development of a vaccine Operation Warp Speed, automatically you put us on high alert. Like, are you skipping steps? Did you, when you hit the accelerator, what did that mean? How were you able to develop a vaccine so quickly? But what I do know is that mRNA vaccine technology has been in the works for the past 10 years. With something as significant as HIV, you talk about a pandemic. It has been, for me, the largest pandemic I have been part of in my lifetime, right? So mRNA in terms of a vaccine for HIV, mRNA vaccine technology in terms of a vaccine for Zika. Remember Zika back in the day? You couldn't go to Brazil or any of the other sexy countries because of Zika. So we were looking at mRNA technology for Zika vaccine, for SARS and MERS, which are coronaviruses, and then other infectious diseases like rabies and CMV, a virus that can cause significant birth defects if a baby is exposed. So the technology has been in existence for the past 10 years. Operation Warp Speed opened up opportunity for just laser focus and funding to create an mRNA vaccine specifically for COVID-19. So how quickly it was developed is not what concerns me at all, because I know that the technology over the past 10 years has been there. What concerned me initially was how politicized the vaccine was. But with the new administration, we're seeing less of that, very little, if any at all. So the technology itself and how long it's been in existence, what we now know is that they've been working on this for the past 10 years in terms of mRNA technology. And then it's, what does this vaccine, what is it composed of? First, it's composed of the mRNA, the messenger RNA from COVID-19, specifically designed to tell the body how to create the spike protein. I consider the mRNA vaccine, that we get from COVID-19 to be like the recipe, right? My soror, Dr. Grady Doc, she did a phenomenal explanation in breaking down the science. I suggest you look her up. She also shared it on Tyler Perry, highlighted her in terms of how she broke the science down. Perfect explanation. I will not try to replicate how she explained it. Instead, what I will use is sort of what I consider to be the way I explain it to my daughter, to my 8-year-old daughter. mRNA is like your recipe, right? And it tells you how to do something, how to create something. So the recipe tells our cells how to sort of create the yeast. If the recipe is for bread, when we introduce the mRNA into the cell, it tells the cell how to make the yeast. But without the other ingredients, you can't make the bread. So without the other ingredients, you're not at risk for COVID-19 infection because the other ingredients aren't there. Simply the start of the creation of the spike protein. But the body is so brilliant is that the minute our bodies start to create it, it recognizes it as foreign, and that's when our immune system shows up and shows out to create an immune response. What does not happen, which is what I have been reading about and been asked about, is does it enter into your DNA? So you have a cell, and within the cell is something called cytoplasm that holds all of the power players within your intracellular space. And within that cytoplasm is the nucleus, which within the center of it is your DNA. mRNA in your cytoplasm is not going to penetrate the nucleus and enter into the space where your DNA exists. As the mRNA sits in the cytoplasm, it gets what's called denatured, broken down, and then punted out by the body. It's just the brilliance of how our intracellular space works. So this concern about the mRNA from COVID entering into our DNA through our nucleus is just not happening. And I can speak on that fairly confidently because, and I won't just say because I'm a doctor, because that's not my area of expertise, right? Vaccine technology is not my area of expertise, but I worked in a lab at Scripps in San Diego where I grew up. And the lab in which I worked was specifically designed to use mouse DNA. And what we did was we introduced mRNA into mouse DNA through the nucleus in order for us to work through our experiments. And so I have that little tidbit of knowledge to help me further understand outside of what I learned in medical school. And then here I am sharing it with you. So that's not what's happening. But let's talk about what this vaccine is made of. One of the concerns is, what are the ingredients, right? So there was a concern a while ago, particularly with pediatric vaccines, about heavy metals, right? Heavy metals being associated with the risk of autism, and one specifically called thimerosal, and whether or not children with vaccines that contain thimerosal, was there an association between those vaccines and autism? And the answer is no. Study after study after study has shown that thimerosal containing vaccines were not causally related to the development of autism. But because of significant concern about thimerosal and heavy metals, thimerosal was removed from most pediatric vaccines. Guess what happened? Autism rates didn't drop, but we still took that heavy metal out. With this particular vaccine, it includes the mRNA. It includes something called lipids, which is sort of like a fatty coating to protect the mRNA so that it can actually enter into our cell. It also allows it to sort of slice, like the slip and slide of for the mRNA, so that it can actually enter into the cell. What also is contained in both the Pfizer and the Moderna vaccines are salts to maintain the pH balance so that the mRNA that's introduced into the cell does not get broken down. You guys already know how important pH balance is. It's why a lot of you guys drink alkaline water. So that's what the salt does, right? But Moderna took it up a notch. They actually added in acetic acid, which for those of you who are like, oh my gosh, they're putting acid in our body, calm down. It's also known as vinegar, right? So these help to maintain the pH balance so that the mRNA can enter into the cell without being broken down. And then there's also a little bit of sugar in the vaccine to keep the shape, the form of the mRNA so that it can successfully be introduced into the body. So those are the ingredients of both the Pfizer and the Moderna vaccine. And, and I feel comfortable with those being the ingredients in terms of this being introduced into my body. So then the next thing that I consider is, how are side effects? How are adverse events being documented? And I can honestly tell you, I did not trust the previous administration to transparently and honestly report out adverse events associated with this vaccine, which is why I did not rush. One of the other reasons why I did not rush at the start of vaccine rollout to sign up, because I just didn't trust that through Health and Human Services, through the CDC, through any of these federally linked health systems, that they would honestly be able to report out what was going on, because they had been muzzled so much during the former administration. But now that the Biden-Harris administration has put people in positions that have the experience, the expertise, the knowledge in Health and Human Services, in the CDC, on his COVID-19 task force, I trust and am confident that the people that he has put in position are going to keep our best interest at heart, right? They're going to allow us to be able to observe what the side effects are, what the adverse events are related to this, to the rollout of the vaccine. And there are numerous systems that we now have available to us, and have historically had available to us, to track what's going on. One of them now being vSafe. There is now an app. I feel like there's an app for that, right? There's an app called vSafe that you right now can download. If you have received either of the COVID-19 vaccines, you can download this app. And what it allows you to do is report out any and every symptom you may have. If your eye twitched after you got it, if your arm is sore, whatever the issue may be, you can download this app and put that symptom in the system so that it can be reported out. The other system that we have is something called a vaccine adverse event reporting system, something called VAERS. It has been in existence, I know, for at least as long as I've been a doctor. It's what I use to report out when a child or baby who I have administered vaccines to has a bad event, right? And I know people say, well, I don't trust doctors. They've drank the Kool-Aid. They're not going to report because they're part of the system. Well, that's where vSafe comes in, because that's an opportunity for you yourself to be able to report out. VAERS is where we as healthcare professionals report out. And guess what? You have access to this information. You can go to VAERS through CDC and see this information. And there are various organizations that also report out to VAERS. The National Healthcare Safety Network, the Veterans Administration, Indian Health Systems, they all report out to VAERS. You can pick the vaccine, the age, the gender, the race, to see how different people are reporting out their side effects, inclusive of COVID-19. And right now, the most common side effect for both vaccines is dizziness. About 1,400 people have reported dizziness. The other common symptoms are soreness and redness at the site of the injection spot, feeling fatigued, having fever, and having muscle aches. Those are the most common side effects. And you have access to all of that reporting out, right? Because they're doing a phenomenal job. They've expanded the capacity to report out. So how am I making my decision? I'm looking at what I call sample size, which is how many people have gotten the vaccine. The critical space in science is a sample size of about 10%. If you have 10% of a population who has gotten a vaccine, gotten the medication, etc., that is a very good sampling, a very good number of people to be able to determine whether or not it's reliable in reflecting the general population. And we're almost there. Today, as of February 3rd, 32 million individuals have now received at least one COVID-19 vaccine. So my 10% threshold in terms of sampling has been met. The next is what is the side effect profile? And one of the biggest concerns that people have had in terms of some of the text messages and direct messages that I've gotten is death, right? Someone actually put on social media that there have been more people dying from the COVID-19 vaccine than have died from COVID-19, which is clearly blatantly false. Unless 460,000 plus people have died after receiving COVID-19 vaccine, which clearly has not been the case, then that's not true. Looking at the numbers, and this is correlation, not causation. So I am not saying that COVID-19 vaccination caused death. What I'm saying is that there were deaths associated with the timing in which the COVID-19 vaccine was administered. And that number is 235. Of the now 32 million individuals who have received the COVID-19 vaccine, as of VAERS reporting today, 235 people have died. The death rate for COVID-19 infections is close to 2%, 1.7% as of today here in the United States, 2% globally. The death rate, if you were to calculate it, which I don't think is appropriate because we have not said that the vaccine caused the deaths that are reported in VAERS. 235 individuals of the 32 million people who have had the vaccine, 235 people have died. That puts the death rate at 0.0007%. All right. So I'm not concerned about death in association with the COVID-19 vaccine. And of the symptoms that have been identified, the most common ones, they're no different than when I get my annual flu shot. And, part of my concern was Guillain-Barre. Part of my concern was Bell's palsy. But what I did with this vaccine is no different than what I've done with other vaccines, right? So as a pediatrician, there were 2 vaccines that came out that I waited to see what happened. One of them was rotavirus. The second was the meningococcal vaccine. With rotavirus, when it first came out, it caused what's called intussusception, telescoping of the intestines on themselves, which decreased blood flow to the intestines, could lead to death of the intestines, and then possibly emergency surgery and even a risk of death. I waited to see if the risk of intussusception in the vaccinated population was higher than that of the general population, and it was. And so the vaccine was taken off the market, recreated, and then put back. I still waited. Once I saw that it was no higher than in the general population, that's when I started to recommend it. The same thing with the meningococcal vaccine. It was associated with something called Guillain-Barre. There were higher percentages of people in the vaccinated population getting Guillain-Barre than there were in the general population. So they took it off the market, recreated, pushed it back out of the market. I still waited. And then when we did not see an increased risk in the vaccinated population compared to the general population, that's when I recommended it. And that's no different here in with COVID-19. And when I look at the side effect profile for both Moderna and Pfizer, I'm comfortable in making the recommendation, and I'm comfortable in getting the vaccine. And then thirdly, can I trust the administration? Yes, I can, because they have committed to science. They have committed to trusting the science. They have said and been very transparent in how they're connecting to science. They have put people in positions that are reflective of science. And so for me, it's not a matter of if, but when. And so we are close to that 10% sampling, likely by not the end of this month, at least by the beginning of March. I will be rolling up my sleeve. Somebody will be alcohol swabbing my arm, and I will be receiving the COVID-19 vaccine. So there you go. That's my process. Let me know if you have any questions. I certainly entertain if there's any information that you have that refutes some of the stuff that I've talked about and it's evidence-based, not opinion-based. Definitely let me know. That's what we're here for, to dialogue, to talk about these issues, all right? But I hope it helps to see sort of what a doctor's process is, especially one that did not immediately jump on board. I hope that it helps you in making your decision, all right? I'll see you at our next update. Love you guys. Dr. Yola out.